injury, the Book of Quantum contains a guideline of injuries and related values. Some of the value ranges displayed are quite wide, and this reflects the fact that the severity of injury, even within the categories listed, can vary considerably. In addition, the same injury can have different effects on different people. None of this rationale has been utilised in terms of the insulting and derisory levels of compensation set out in the nurses' scheme. It goes on to say, the values quoted do not represent the views of PIAB or any other parties and reflect the reality of current compensation levels. Again, I'll repeat that. Reflect the reality of current compensation levels. On categories of injury, it states, the categories of injury are based on the World Health Organization's International Classification of Diseases version 9 and follow a simple structure of body region, body part, injury type. What model is outlined in the nurses scheme? Is it a Minister Harney model, a HSE model, or sure it's only nurses, anything will do model? The categories of injury outlined in the nurses scheme and the levels of compensation applicable do not, in our view, meet any reasonable national or international criteria. The management team, in defending the derisory compensation in the nurses scheme, have indicated that the reasons for the higher amounts in the PIAB Book of Quantum is because they cover everything, including loss of wages. Wrong again. The foreword in the PIAB Book of Quantum states, the book only deals with compensation for pain and suffering. A claimant may also be entitled to claim under other headings for actual financial losses. Minister, with respect, you cannot condone what has happened in this dispute. A government task force set up by your predecessor, Mr. Micheál Martin, TD, who undertook in writing to implement the findings and the recommendations of the task force. This was reneged on. Just on this issue, an interesting fact relating to the task force is that the Department of Health representatives were reluctant to accept the PNA research findings that 857 nurses were assaulted in 2001. Instead, the department did its own survey and found that 1,662 nurses were actually assaulted. The PNA included only nurses who were physically assaulted and did not include incidents of serious threatening behaviour. Their list of injuries published in the task force report on foot of the Department of Health's own survey are interesting. Sprain, bruising, tenderness, head facial injury, burn, scald, cut, graze, scratch, cut requiring sutures, back, neck injuries, stress-related injury, fractured bone, needle stick injury, bite. I have to ask you, Minister, why are the vast majority of these genuine injuries not included in this scheme? They have been identified as legitimate injuries by your department. They have now been excluded by your department. Your undertaking at our meeting in 2005 that while the government had decided not to implement the findings and recommendations of the task force, notwithstanding this, however, you stated that both yourself and government had sympathy with anyone injured by assault, and in that regard you were now going to direct the State Claims Agency to draw up a scheme similar to the PIAB, but which would exclude psychological trauma and retrospection. A compensation scheme for nurses was agreed in principle by Cabinet in January 2007, but excluded psychological trauma and retrospection. The Union challenged these exclusions at the LRC and at a full hearing of the Labour Court. The Labour Court put it to the representatives of the government at the hearing, isn't it the case that the government made a promise and then changed its mind? This sums it up. The highest industrial court in the land has recommended a compensation scheme for nurses to include cover for psychological trauma and to include cover for a number of outstanding cases, and your government is ignoring the Labour Court recommendation. Remind me again, Minister, is this the same court that you and other members of government described as the court of last resort, and which you and your officials have lectured nurses on in the past about an obligation on nurses to accept recommendations from the highest industrial court in the state? This is total hypocrisy. We had no other option but to ballot our members for industrial action. We have been through every process and were successful. The result of the ballot has been a resounding vote in favour, and we have served notice of our intention to engage in industrial action together with SIPTO. This action will commence on April the 30th. Perhaps, Minister, prior to this date, you should ponder on what the Labour Court said in recommendation number 18864. The Court is of the view that the unions have a legitimate expectation since 2002 of a resolution of their claims for a satisfactory compensation scheme. Before I move away from the issue, I wish to deal with the National Working Group on Work-Related Aggression and Violence. This committee was effectively suspended for almost 7 months. The PNA in its submission to the Labour Court regarding the manner of the introduction of the embargo being contrary to the terms of Towards 216 and to the Consultation and Information Directive quoted the suspension of this group as being a casualty of the embargo. Mr Mulligan vehemently denied this, even though he was a member of the group in possession of an email from Mr Pat Harvey, chairman of the committee, which stated the opposite. An extract from the email from Mr Harvey on the 5th of November 2007, as you know, our project facilitator and principal author is committed to on a full-time basis. His release, which involves a sequence of moves and replacements, has been difficult to accommodate at the moment with the current recruitment pause in place within the HSE. Discussions are currently underway with the HSE to secure his release at the earliest opportunity. It took 7 months. This committee has only recently recommenced its deliberations. A draft of the report circulated recently contains an introduction. Healthcare is a unique service in that it is structured within a socio-political context and delivered within professional, regulatory, legal and moral contexts. The Irish public have valued a high-quality, humane service delivered by staff whose professional caring has been acknowledged globally. It is reasonable for service users to expect to be treated and for staff to expect to work in an environment which is safe and free from the expectation of being abused, threatened or physically assaulted. Nevertheless, the potential for aggression and violence within Irish health service environments poses a very significant problem for staff. Oh, for such a pious aspiration that psychiatric nurses would work in an environment which is safe and free from the expectation of being abused, threatened or physically assaulted. This High Court committee, which commenced its work with such enthusiasm and energy and driven by a very competent chairman in Mr Harvey, is now, in my view, lost its impetus, and the high expectations that I and our organisation had that this committee would deliver real and meaningful protection for staff and indeed for patients has taken a battering. If the work of the committee is of such little significance that the HSE could not arrange to have one man released or replaced for about 6 months, what real hope is there that any recommendations that emerge in any report of this committee will have any status, much less any hope of being implemented? Minister, the manner in which nurses have been treated in respect of this one issue alone tells us a lot about the value and respect that this government places on nurses and on the difficult work that we do. I wish to deal with the outcome of the nurses' dispute and in particular the processing of our claims over the past couple of years. The PNA and the INO took claims relating to the pay and other conditions of nurses and midwives to the Labour Court on 3 occasions. In each of those recommendations, the Court directed the INO and PNA to benchmarking as the only way of having our claims addressed. Recommendation 17526 recorded that the only way these claims can be progressed is through the benchmarking body. In Recommendation 17805, the Court indicated that future benchmarking exercises was the appropriate forum to examine the full position of the RMHN grade vis-à-vis other social care professionals. In Recommendation 18763, when dealing with the anomaly between social care workers and nurses and midwives, the Court recorded its view that such a claim could only be processed through benchmarking. And in relation to the claim for parity with therapeutic grades, colleagues, the Court is of the view that the only mechanism available by which this claim can be